So again, also just wanted to start by expressing my gratitude and to the Rapport Foundation. I know I speak on behalf of all the Brigham Fellows who are incredibly grateful to kind of be able to pursue projects that we are passionate about. So I'm going to talk about the project that I'm passionate about. And I want to transition a little bit from the research lab into the hospital. And I'm going to start with a story about a patient who recently came to the hospital. He was a 65-year-old guy who was at home. He developed a fever and a cough, and while he was there at home, he started taking some cough medication. He took some Tylenol, and when the fever stayed and his cough remained, he decided to come to the emergency room. When he got to the emergency room, the doctors did a chest x-ray. They saw that he had a new pneumonia, and so they admitted him to the hospital. After he was admitted, the hospital team started him on antibiotics for his pneumonia. They changed up his cough medications to a new one to help with his cough. He was a little bit nauseous from all of the antibiotics, so they gave him a nausea medication. He couldn't sleep because the hospital is extremely loud and busy all the time, and so they gave him a sleep medication, and which is maybe a similar story for a lot of people. And the hospital team, every day, they were checking his blood work in his labs, and they were monitoring his kidney function. They were looking at his blood counts. They were looking at his liver function. And about 3 days into the hospitalization, his pneumonia was getting a lot better. And that morning, though, the team noticed that his liver function all of a sudden was abnormal on the labs. And this was new for him. And so the team, as they do, started thinking about all of the different causes for abnormal liver function. They sent off a bunch more tests looking for new infections, autoimmune diseases, thyroid diseases. They did an ultrasound of his liver looking for blood clots in the liver, looking for cirrhosis. And while they were doing these tests and waiting for different results to come back, they also looked through his medications. And they tried to kind of piece together this puzzle of which of the 10 medications that we had started, or the team had started in the hospital, could potentially cause liver problems. And even more puzzling, which one was started at the right time relative to when the liver function started getting worse. Now, this last part may seem like a relatively simple thing to do. As internal medicine doctors, we prescribe a lot of medications, and we know the common side effects from most of the medications that we prescribe. But we definitely don't know all of the side effects or all of the drugs. And we really struggle with trying to figure out when a medication was started relative to when some new side effect develops. In the medical record, this means looking through multiple different charts and different pages and kind of trying to piece that all together. And it's a hard process. And so this is the problem that the project I've been working on is trying to solve. Because the man I talked about is not unique. Adverse events from drug side effects are the third most common cause of something bad happening in the hospital to somebody. And this experience of trying to figure out what did we just do to somebody who came asking for help that's causing some new problem is common for doctors and a very frustrating experience. Part of the reason this is so difficult is that right now what exists is there are lots of online databases that hospitals subscribe to. And so Brigham and MGH have probably 4 different databases where you can go and you can type in a single medication and scroll through a long list of all of the side effects. Anybody who's ever looked at kind of the package insert for Tylenol or Benadryl has seen, 20 pages worth of different side effects that all have varying degrees of kind of truthfulness or acceptance within the medical literature about whether or not they actually cause the problems. But what we don't have is a way to look at the patient level and say, I want to look at my patient and all of the medications that he or she is on, along with the labs, the problems that we know they have, the imaging tests that we've already done, and integrate that all together. And so that's what the project we've been working on does. And so kind of thinking back to that our initial patient, when the team started thinking about, I wonder if this is an infection, I wonder if this is an autoimmune disease, they're very prescribed steps as to what to do next. If you think it's an infection, you send some blood tests. If you think it's an autoimmune disease, you send some other blood tests, and then you just wait for the lab to tell you if you were right or wrong. And so our goal is to create something similar for medication side effects, somewhere where you can just not necessarily send a blood test, but just click on a link inside of the medical record, and it pulls up all of the information that you want. And so this app that we've been developing with a patient's permission. When you first open the app, what it does is it looks through all of the medications a patient has been written for. It looks when those medications were actually administered. It also knows what the lab trends have been, looking at the liver function, if that's what you're curious about, the kidney function, or other blood counts. And it can plot all of those together. So you can see a graph of liver function slowly getting worse, and medications that were started here, here, here. And using the online databases that Brigham and MGH and other hospitals already subscribe to, it can pull percentages of what the probability of any one of those given drugs, especially when it started before the bad thing has happened, and put that all on the same screen for you. Our hope with this is that it can avoid doing more things to patients. You know, if we can quickly see that, oh, the new liver problem is due to this medication we started 3 days ago that in the literature has been shown 20% of the time to cause this problem. Maybe we don't need to poke the patient to send off a bunch more infectious studies. We don't need to send them downstairs in the middle of the night to get more radiation and ultrasounds and all these other things that we do to patients while they're in the hospital. And to be clear, what we're talking about and what we're working on, it's not an alerting system. I think for the doctors in the room who've worked in Epic or in any other medical record, there are lots and lots of alerts. And the data about all of these alerts is that essentially nobody listens to them because there are too many of them and doctors don't agree with them. So this is much more of an information system. When you get to the point in your thought process, I've thought about infection, I've thought about thyroid disease, now I want to think about the medications and I just want help. That's when going into our app, our project, will be helpful. And again, just kind of showing that information at the time when you want it. Like everything related to IT and the hospital, we've run into a few issues with this. And that's essentially where we are right now, which is we want to build this app in a way that it doesn't just work for Epic, it doesn't just work for Cerner or Allscripts or any of the other medical record systems that are out there. We want something that theoretically people could just pull up on their phone or could integrate with any medical record system that exists. This has been a difficult challenge. There are standards being established across the United States, and there's actually new kind of federal mandates and laws saying that all health record systems should really implement these. And so we are waiting for those to get a little bit more mature as we are working on building this kind of system that can pull all of the information about a patient that we want. But we think it's going to be something useful. I'm on service right now in the hospital. I had almost the exact same, a very similar patient just yesterday. The patient had been in the hospital for 4 days. All of a sudden, her platelets, one of her blood counts was lower than it had been. And I was talking with the medical students and the residents, and they said the exact same thing. Maybe this is the infection, maybe it's a medication, and she was on 25 medications. We tried looking through, you know, as many of the ones that we off the top of our head knew, and we Googled a few more of them. But it's a frustrating process. And so that's kind of what inspires us to keep on going. I think thinking down the line, we also think that there's other potential here, that this idea of once the FDA approves a medication, it doesn't necessarily mean it's safe. There have been, you know, over the past few months, there's a new antibiotic that I think has had 3 different black box warnings about new side effects that we didn't know about until recently. And so the idea would be that if we could capture the data, that if people are clicking on the liver labs when they are on X medication, maybe we could, even before the FDA, say, oh, maybe there's some relationship here, similar to what Google has done with the kind of tracking influenza even before the CDC is able to do it. That's a few years down the line. Right now we're still working on just kind of building the graphing functionality that we're talking about.